Your muscles are not just getting older. Every night they're quietly asking for what they need to repair. Miss that window, and legs that once felt steady can become stiff, heavy, and unreliable. But there is a nightly ritual, simple, targeted, and timed, that can change the direction of that trend. I'm Dr. Daniel Harrington. I've spent more than 2 decades helping older adults stay independent, walking safely, getting up from chairs without fear, and sleeping without waking to pain. In the clinic, I see the same pattern again and again, a slow fade in leg strength that starts at night. Not because people are lazy or fragile, but because the body's repair processes depend on having the right nutrients available at the right time. And aging, medications, and modern diets often leave those shelves empty when the body needs them most. Tonight, I want to walk you through the science you can use and the exact forms and timing that matter. This isn't about piling pills. It's about one small, repeatable bedtime ritual that primes your body to protect muscle, nerve, and connective tissue while you sleep. If that matters to you, tap like so other seniors can find this tip. Sleep is not downtime for your muscles. It's the rebuilding shift. Think of sleep as the body's repair shift. During the day, your muscles do the work of living, standing, walking, carrying groceries. At night, the body reallocates resources to clean up damage, rebuild proteins, and repair tiny tears in muscle fibers. Hormones shift, inflammation cools, and genes that code for repair turn on. This is when muscle protein synthesis ramps up, but only if the building blocks and signals are available. Here's the catch. That repair window is finite. Most people go 10 to 12 hours between dinner and breakfast, and the first part of that fast is when muscles most need specific nutrients to rebuild efficiently. If amino acids, certain vitamins and minerals aren't available then, the body can drift toward net muscle breakdown rather than repair. For older adults, this risk is amplified. Aging changes digestion, reduces appetite, alters absorption, and many common medications interfere with nutrient uptake. That's why timing beats simply taking more. When you give the body the right nutrients, 30-60 minutes before bed, or with a small fat-containing bedtime snack, you make those compounds available precisely when the repair machinery is gearing up. What I'll do next is walk through the 7 nutrients that together form a practical nightly defense for leg strength. What each one does overnight, why seniors commonly miss it, the best chemical form to use, how to time it, and what to watch out for. These are the nutrients I use most often in clinic when the goal is preserving muscle, improving balance, and preventing falls. I'll also label any dose examples as examples and remind you to check with your clinician because safety matters. Magnesium, the relaxer, rehydrator, and setup nutrient one-sentence function. Magnesium helps muscles relax, supports overnight rehydration of muscle cells, and primes the body to start repair. Why it matters at night. Magnesium participates in hundreds of enzyme reactions. At night, it helps quiet excess nerve activity, reduces muscle cramping, and supports the channels that pull water and electrolytes into muscle cells. A small but important part of preparing fibers for repair. When muscles are hydrated and calm, protein synthesis and repair processes work better. Why seniors commonly lack it. Older adults often eat less of the leafy greens, nuts, and legumes that supply magnesium. Proton pump inhibitors, some diuretics, and older age itself can lower magnesium levels. Low magnesium may show up as restless legs, nighttime cramps, or difficulty falling asleep, symptoms many people chalk up to normal aging. Best form and timing. Magnesium glycinate is my usual pick for bedtime. Glycinate is gentle on the stomach and has calming properties that many people find helpful just before sleep. Take it 30-60 minutes before bed, alone or with a small sip of water. If you take it with a light snack, avoid large, sugary treats. A few almonds or a small piece of Greek yogurt are fine. Practical tip. If you notice nighttime leg cramps or waking with tight calves, try switching to magnesium glycinate rather than magnesium oxide or magnesium citrate. Glycinate is more likely to aid sleep quality because the glycine moiety has calming effects. Safety caveat: magnesium can interact with certain medications, and in people with kidney impairment, it can accumulate. If you have kidney disease or take medications that affect magnesium handling, consult your clinician before starting an evening magnesium supplement. Simple visual to imagine. Picture muscle fibers as strings that need both slack and moisture to be repaired. Magnesium gives the strings that softness and hydration, so repair can begin. Evidence Q. Clinical practice and controlled studies support magnesium's role in sleep quality and muscle cramp reduction in older adults. I'll link verified studies in the description so you can review the evidence. Vitamin B12, methylcobalamin sublingual. The nerve support booster one-sentence function. B12 supports nerve signaling and the repair of nerve sheaths that keep muscle control sharp. Why it matters at night. Muscle strength isn't just about muscle tissue, it's about nerves that tell muscles when and how hard to contract. Overnight, the nervous system clears metabolic byproducts and begins repair of the myelin sheath that insulates nerve fibers. B12 is a cofactor in processes that support nerve maintenance and communication. If nerves don't recover well, muscles can feel weak or uncoordinated, even if the muscle tissue itself is intact. Why seniors commonly lack it? The ability to absorb B12 from food declines with age because stomach acid and intrinsic factor production drop. Long-term use of acid-reducing meds also lowers absorption. That's why some older adults can have normal diets but low B12 levels. Best form and timing? Methylcobalamin is a biologically active form of B12, and many clinicians prefer it for nerve support. A sublingual form, held under the tongue, can bypass some absorption issues in the gut and get B12 into the system promptly. Take it about an hour before bed or right after dinner if you prefer. The overnight window benefits from having active B12 circulating as nerve repair processes begin. Practical tip: if you feel tingling, numbness, or pins and needles in your feet or legs, mention B12 to your clinician. A single small change, switching to a methylcobalamin sublingual or getting a blood test, can clarify whether B12 is part of the problem. Safety caveat: B12 is generally safe, but if you have certain rare conditions or are on chemotherapy agents that interact with B12, check with your clinician. Always interpret B12 blood tests with a clinician, since values and lab cutoffs vary. Simple visual to imagine. Think of B12 as the oil that keeps the nerve cables insulated and responsive overnight. Without it, signals become ragged and mistimed. Evidence Q. Studies in older adults have linked B12 deficiency to gait disturbances and cognitive symptoms. There is evidence that correcting deficiency improves these outcomes. Verified references will be in the video description. Vitamin D3, the night shift supervisor for muscle and gene activation, one-sentence function. Vitamin D3 helps turn on genes essential for muscle function and supports the mineral balance needed for strong, coordinated legs. Why it matters at night? Vitamin D acts like a signaling molecule, binding to receptors in muscle cells and influencing genes involved in muscle contraction and repair. Overnight, when the body is deciding which repair programs to run, having adequate vitamin D available supports the expression of those muscle-focused genes. Why seniors commonly lack it? Older skin makes less vitamin D from sunlight. Many seniors spend less time outdoors, and even those who go outside may wear sun protection for good reason. Dietary sources are limited. Certain medications and medical conditions can also lower levels. Best form and timing. Vitamin D3, cholecalciferol, is the preferred form. Because it is fat-soluble, take D3 with a small amount of healthy fat, for example a teaspoon of olive oil, a few walnuts, or a bit of avocado. Ideally with your evening meal or a small post-dinner snack, so it's available during the early part of the night. Timing 30-60 minutes after dinner works well for most people. Practical tip: if you're already on vitamin D, ask your clinician to check a blood 25-OHD level before making large changes. If you live in northern latitudes or have limited sun exposure, a modest evening dose can be part of a nightly routine. Safety caveat: vitamin D is safe when used appropriately, but very high doses over long periods can lead to high calcium levels. If you have a history of kidney stones or hypercalcemia, check with your clinician before increasing vitamin D. Simple visual to imagine. Picture vitamin D as the supervisor sending memos to muscle cells at bedtime. Start Repair Protocol A. Prioritize balance-related fibers. Evidence cue: supplementation trials in older adults have shown improvements in muscle function and fall risk when deficiency is corrected. I'll point to reputable trials and reviews in the description. Vitamin E, natural D-alpha tocopherol, the overnight antioxidant guard. One sentence function: vitamin E protects muscle cells from oxidative damage overnight, letting repair proceed without the interference of free radicals. Why it matters at night: cell repair is an active process that can temporarily increase oxidative stress. When antioxidants are present, they neutralize damaging free radicals, so rebuilding proceeds cleanly. Vitamin E, a fat-soluble antioxidant, helps protect cell membranes, including those in muscle, during the repair process. Why seniors commonly lack it: modern diets can be low in the natural forms of vitamin E, and synthetic forms are less effective. Some fat malabsorption conditions and long-term medical therapies can reduce vitamin E availability. Best form and timing: look for natural vitamin E, labeled as D-alpha tocopherol, not DL-alpha, which is synthetic. Like vitamin D, vitamin E is fat-soluble, so take it with a small amount of dietary fat in the evening, either with dinner or with a light post-dinner snack. This helps the vitamin reach cell membranes during the night. Practical tip: avoid megadoses of vitamin E unless directed by your clinician. Natural vitamin E, in modest recommended amounts, provides antioxidant protection without the risks linked to very high intakes in some studies. Safety caveat: vitamin E can interact with blood-thinning medications. If you are on anticoagulants, check with your clinician before starting vitamin E. Simple visual to imagine: think of vitamin E as a gentle shield that sits on the muscle cell surface overnight, catching sparks before they start a bigger problem. Evidence cue: research links antioxidant support with better muscle recovery in older adults in specific settings. I'll include solid references in the description for those interested. Keeping the ritual practical: timing, small fat, and consistency. Before I go on to the next nutrients, I want to underline 3 practical rules that matter more than brand names. 1. Timing over quantity. Try to have the key nutrients available about 30-60 minutes before bed, or take fat-soluble vitamins with a small evening snack, so absorption peaks during the early repair window. 2. Use the right chemical forms. For seniors, form matters: magnesium glycinate, methylcobalamin B12, sublingual often, D3 cholecalciferol, natural D-alpha vitamin E, P5P for vitamin B6, buffered or liposomal vitamin C, and K2 as MK7 are the forms I see help most consistently. 3. One change at a time. Start small. Add one element to your routine and see how you sleep and move over a few weeks. That makes it easier to notice effects and keep safety simple. A quick note on interactions and testing. Certain combinations, especially vitamin K2 if you're on warfarin or other anticoagulants, require a clinician's oversight. I recommend having basic checks like vitamin D and B12 levels drawn before making large changes, and always run plans by the clinician who manages your medications. Tease the next nutrients: vitamin B6 as P5P, vitamin C, buffered or liposomal, and vitamin K2, MK7. Round out a system that supports protein metabolism, collagen and connective tissue, and mineral routing. They each bring a unique role to make the nightly repair broader than just muscle fibers. Before I get there, let me introduce you to Stanley, a short, real-world example of how timing and form can matter. Stanley's first visit, the setup. Stanley is a retired teacher in his early 70s. He came to my clinic because he'd started to avoid his morning walk. He blamed stiff joints and said his legs felt heavier and slower. He slept enough hours, but woke feeling as if he'd been on a long hike. He'd fallen once in his garden, and though he wasn't seriously hurt, the fear of falling again had started to pull him back from activities he loved. On examination, his strength was modestly reduced for his age. But what struck me was his report of nighttime muscle cramps and waking with numbness in his toes sometimes. His current routine was typical: a small dinner at 6 p.m., no supplements save a multivitamin in the morning, and a prescription for a mild acid reflux medication he'd been on for years. He also spent most days indoors. This combination is common. Reduced dietary variety, medications that blunt absorption, and long fasting windows between dinner and breakfast can leave the repair window short on tools. The first change we made wasn't dramatic. We focused on timing and form. We switched magnesium to magnesium glycinate, taken about 45 minutes before bed, to help with cramps and sleep quality. We added a methylcobalamin sublingual B12 after dinner to give nerve repair a boost. We started a modest evening dose of D3, taken with a teaspoon of olive oil after dinner, to help gene activation for muscle repair. We labeled doses as examples in the chart I gave him, and emphasized, this is a clinical example, not a prescription for everyone. I asked him to check with his primary care doctor about his reflux medication and to get basic B12 and vitamin D levels drawn. The first 3 weeks, sleep and confidence. Within 2 weeks, Stanley reported sleeping more restfully. The night cramps that had woken him became less frequent. He said waking felt less like dragging through sand and more like having a little energy reserve. Walking remained cautious, but his confidence was returning. By 6 weeks, we began to see small functional improvements. He could rise from his favorite chair without using his hands for balance as often, and he reported covering a longer distance during his morning walk. His fear of falling eased. The change wasn't a miracle, as it was measurable and meaningful. I'll come back to Stanley's 3-month check, but his early improvement shows how simple timing and form changes can jumpstart the repair process while we continue to fine-tune labs, diet, and exercise. Why diet and routine alone often don't cut it. You might be thinking, why not just eat a bigger dinner or have a protein shake before bed? That can help, and protein before sleep has been shown to aid muscle protein synthesis. But for many older adults, appetite is low, or acid-suppressing drugs reduce protein digestion. Supplements in the right forms and timed correctly are a low-friction way to ensure that the specific nutrients that act as catalysts for repair are present. Also, some nutrients are fat-soluble and need a bit of dietary fat to be absorbed. Taking D3 and natural vitamin E with a small fat-containing bite makes a big absorption difference. For others, like sublingual B12, the delivery method bypasses common absorption obstacles. A measured approach, screening, modest examples, and clinician partnership. Before making changes like Stanley's, I ask patients to take 3 steps. 1. Simple screening. Note symptoms: nighttime cramps, waking stiff, numbness, slower walking, more reliance on furniture to stand. These flag the need for further evaluation. 2. Basic testing. Vitamin D and B12 levels are common and easy to check. If abnormal, they guide targeted dosing. I don't recommend blind megadoses. 3. Partner with your clinician, especially if you take prescription medications. Some nutrients change how drugs act. Others require monitoring. When I share examples of doses in clinic, I present them as examples used in practice, a starting point for discussion with your clinician, not a one-size-fits-all prescription. Small visual cue for your memory. Imagine a bedside tray with 3 items: magnesium glycinate, a small bottle of sublingual methylcobalamin, and a teaspoon of olive oil with vitamin D3. That trio, taken in the hour before bed, primes repair. Add the rest of the nutrients in the coming days or weeks, as your clinician advises, where we are now and what's coming. We've covered the repair shift concept and the first 4 nutrients, magnesium, B12, D3, and vitamin E, with practical forms and timing. These lay the groundwork, but they are only half of the nightly team. Vitamin B6 as P5P, vitamin C, buffered or liposomal, and vitamin K2, MK7 bring essential roles in protein metabolism, collagen and connective tissue strength, and mineral rooting that prevents calcium being misplaced. Those 3, plus how to assemble a simple, copyable nightly checklist and a concrete safety plan if you're on blood thinners or have kidney disease, are what we'll tackle next. Before I go further, one critical safety reminder: if you take prescription medications or have major medical conditions, talk to your provider before starting new supplements. That includes anticoagulants, certain heart medications, kidney disease, and active cancer treatments. We want to support repair without putting you at risk. At this point, you should be feeling the central idea. Recovery happens at night, and the best way to protect leg strength is to give the body what it asks for during that window: the right forms, at the right time, consistently. I'll pick up with vitamin B6, P5P, vitamin C, and vitamin K2 next, then pull everything into a practical evening routine you can try tonight. I'll also finish Stanley's 3-month outcome and give you a simple checklist you can use and share with your clinician. If you want the sources and clinical trials I mentioned, I've compiled peer-reviewed studies and reviews. You'll find them linked in the description so you can read the evidence yourself. Vitamin B6, P5P, the protein traffic controller and sleep-friendly helper, one-sentence function. P5P, the active form of vitamin B6, helps the body use amino acids for muscle repair and supports neurotransmitter balance so sleep and repair can proceed smoothly. Why it matters at night? Overnight, the body rebuilds structural proteins and fine-tunes enzymes that direct how amino acids are used. Vitamin B6 in its active form, pyridoxal 5-phosphate, P5P, is a key cofactor in those reactions. It helps convert dietary amino acids into the building blocks muscles need and assists in neurotransmitter pathways that regulate sleep and nerve function. If P5P is lacking, the assembly line for muscle repair can be slower or less efficient. Why seniors commonly lack it? Older adults may eat less protein overall, and some medications, including certain diuretics and anti-inflammatory drugs, can alter B6 status. Additionally, some over-the-counter multivitamins use pyridoxine, which requires conversion in the liver to the active P5P, a step that can be less efficient with age or liver stress. Best form and timing. P5P is the preferred form for older adults because it's already active and doesn't require conversion. Take P5P 30-60 minutes before bed with your magnesium glycinate when possible. The two support complementary processes. Magnesium helps the muscle relax and hydrate, and P5P helps direct protein and enzyme activity toward rebuilding. Example used in some clinical settings: a modest evening P5P dose paired with magnesium glycinate as part of a bedtime routine. but discuss exact dosing with your clinician. Practical tip. If you're taking a multivitamin in the morning, consider adding a small P5P supplement in the evening, rather than relying solely on morning dosing, because we're trying to time availability with the repair window. Safety caveat. High doses of pyridoxine over long periods have been linked to sensory neuropathy. Using P5P allows lower, more effective dosing, but always run any plan with your clinician, especially if you're on medications that affect the liver or nervous system. Simple visual to imagine: picture P5P as a traffic director at night, signaling which amino acids go to muscle scaffolding and which go to other tasks. Keeping the repair crew focused on rebuilding legs. Evidence Q. Clinical nutrition research supports the role of B6 in amino acid metabolism and neuromodulation. I'll list peer-reviewed references in the description so you can check the studies for yourself. Vitamin C, buffered or liposomal. The collagen and antioxidant partner one-sentence function. Vitamin C supports collagen formation for connective tissue and helps neutralize oxidative stress that rises during active repair. Why it matters at night. Muscles are anchored to tendons and fascia, connective tissues that rely on collagen for strength and elasticity. Building and remodeling collagen is part of what keeps joints and tendons working smoothly with muscle. Vitamin C is essential for collagen cross-linking, and it also acts as an antioxidant during the repair process. Repair can temporarily raise reactive oxygen species. Vitamin C helps keep that activity from damaging cells and interfering with rebuilding. Why seniors commonly lack it. Fresh fruit and vegetable intake can decline with age for many reasons: appetite, dentition, digestion. Smoking, certain chronic illnesses, and some medications can further increase vitamin C needs or reduce levels. Best form and timing. Buffered vitamin C is gentler on the stomach. Liposomal vitamin C offers improved cellular uptake for some people. Take vitamin C in the evening, so it's present during the connective tissue remodeling phase of sleep. If you're prone to reflux or sensitive stomach, buffered forms reduce irritation. Vitamin C is water-soluble, so it doesn't require fat, but taking it with a small bedtime snack can make it an easy habit. Practical tip. If you have a sensitive stomach, try buffered vitamin C or split doses across the day, with a smaller portion in the evening. Pairing vitamin C with your nighttime protein, if you have it, supports collagen synthesis directly where it's needed. Safety caveat. Very large doses of vitamin C can cause digestive upset for some people and may affect certain lab tests. Mention it to your clinician if you're being evaluated, or if you have a history of kidney stones. Simple visual to imagine. Think of vitamin C as the mason's mortar maker. It helps create the glue connective tissue needs so muscles and tendons reattach and regain strength overnight. Evidence Q. Studies show vitamin C supports collagen synthesis and reduces markers of oxidative stress in repair contexts. Details and citations will be linked in the description. Vitamin K2, MK7, the mineral traffic director. One-sentence function. Vitamin K2, MK7, helps direct calcium to bone where it's needed and away from soft tissues, supporting coordinated mineral balance that benefits muscle and connective tissue function. Why it matters at night. Mineral balance shifts during sleep. Calcium is central to muscle contraction and relaxation. K2's role in activating proteins that lock calcium into bone and keep it out of soft tissue supports healthy muscle and vascular function. When calcium is routed properly, muscles work more predictably and connective tissues avoid calcification that can stiffen movement. Why seniors commonly lack it. Dietary sources of MK7 are limited unless you consume fermented foods, and absorption can be affected by age. Many people aren't aware that K2 differs from K1 found in leafy greens. MK7 is a longer-acting form that's often preferred for supplementing in older adults. Best form and timing. MK7 is the recommended form of K2 for nightly use because it has a longer half-life in the body. Take K2 with a small amount of healthy fat in the evening, so it's available as the repair and mineral rerouting processes get going. If you're already on a vitamin D regimen, pairing D3 and K2 makes physiological sense, but talk to your clinician before combining. Practical tip: if you're on warfarin, Coumadin, or other prescription anticoagulants, don't start K2 without discussing it with the prescriber. K2 affects the same clotting pathways that those drugs target. Your dosing and monitoring plan will need clinician oversight. Safety caveat: the single most important safety note for K2, it can interact with anticoagulant medications. Also, if you have complex cardiac or clotting conditions, get specialist input before adding K2 to your nightly routine. Simple visual to imagine. Picture vitamin K2 as a traffic cop at night, waving calcium toward bone construction sites and keeping it off delicate roadways where it would cause gridlock. Evidence Q: research into K2's role in mineral metabolism and vascular health continues to grow. I'll include accessible reviews and trials in the description for clinicians and curious viewers to review. Putting the 7 together, how they act as an integrated nightly defense. When you assemble magnesium glycinate, methylcobalamin B12, vitamin D3, natural vitamin E, P5P, B6, buffered or liposomal vitamin C, and MK7 vitamin K2 into a timed bedtime routine, you're creating a coordinated environment for repair. Magnesium and P5P help muscles relax and prioritize amino acids for rebuilding. B12 ensures nerves are insulated and signaling clearly. D3 turns on repair genes and supports muscle cell responsiveness. Vitamin E and C buffer oxidative stress, so cellular rebuilding isn't derailed. K2 keeps minerals where they belong, so the mechanical side of movement, tendons, ligaments, bone interplay, functions smoothly. Think of it as staging a nighttime crew. Each specialist arrives at the right hour and brings a unique tool. Missing one specialist slows the whole operation. That's why timing and form matter more than simply taking a random handful of pills. Practical safety frame, testing, pacing, and medication checks. Before making a multi-supplement plan, do 3 things I use in clinic. 1. Test when possible. Simple blood tests for vitamin D and B12 help guide targeted dosing. Calcium and basic metabolic panels can inform safety for fat-soluble vitamins and magnesium. I don't give strict lab cutoffs here. Your clinician will interpret your labs in context, but testing replaces guesswork with direction. 2. Start slow. Add 1 element to your evening routine at a time and monitor sleep, bowel habits, muscle cramps, and any new symptoms. That way, you can notice benefits or side effects and share them with your clinician. 3. Check medications. If you're on anticoagulants, immunosuppressants, heart medicines, or certain seizure drugs, loop in the prescriber before starting K2, altering vitamin D, or adding large amounts of any nutrient. For kidney disease, check with your nephrologist before starting magnesium at night. Stanley at 3 months, the fuller picture. Back to Stanley. After the first 6 weeks of changes, magnesium glycinate at night, sublingual methylcobalamin after dinner, and a modest D3 dose with a teaspoon of olive oil, we continued to fine-tune his plan. At weeks 7 to 12, we added P5P in the evening and a buffered vitamin C to support connective tissue. We kept an eye on his labs. Vitamin D improved into a range his clinician agreed was appropriate, and B12 rose after sublingual dosing. We discussed, and his primary care doctor cleared K2 for him after confirming he was not on anticoagulants. By 3 months, the differences were stronger and more functional. He no longer avoided his neighborhood route. He reported fewer nighttime leg cramps, steadier balance on curbs, and an easier time rising from low chairs. His walking distance increased, and his gait looked more confident. Not because he had suddenly gained dramatic strength, but because nerve signaling, hydration, connective tissue support, and mineral balance had all aligned to make each step more efficient. Perhaps most meaningful to him was psychological. The fear of another fall had receded enough for him to volunteer at the local library again. That regained confidence is a big, real part of independence that we often underplay in clinic. Stanley's outcome is not guaranteed for everyone. It illustrates a principle. Timed, targeted, and coordinated nutrients, along with clinician oversight, modest exercise, and attention to diet, can create the conditions that let repair work more effectively at night. Lifestyle anchors that boost the nightly ritual supplements are a tool, not an entire strategy. Couple the nightly ritual with simple daily habits to amplify results. Protein spread across the day, and when possible, a small protein-containing snack in the evening can provide amino acids for overnight repair. Older adults often benefit from attention to protein distribution rather than just total daily intake. Gentle resistance work a few times per week preserves and stimulates muscle. Even chair stands, heel raises, and short sit-to-stand sets, done safely with a clinician or trainer's guidance, make the repair signal stronger. Sleep quality matters. Address sleep apnea, restless legs, and reflux with your healthcare team because fragmented sleep undermines repair even if nutrient supply is optimized. Hydration and electrolyte balance support. Cellular repair. Be cautious with excessive evening fluids if you have bladder urgency or related issues. A practical, copyable nightly checklist you can try tonight. I want to leave you with a simple, low-friction bedtime ritual you can discuss with your clinician and try. Follow the steps that are appropriate for your health situation. Start with one change if you prefer. Evening routine example. Copyable. Examples of forms and timing. After dinner or with a small post-dinner snack within 30-60 minutes, take vitamin D3, cholecalciferol, and natural vitamin E, D-alpha-tocopherol, with a small fat source, a teaspoon of olive oil, a few walnuts or a slice of avocado. If you're on vitamin D already, check with your clinician before changing dose, timing. After dinner, or about 60 minutes before bed, place methylcobalamin sublingual B12 under your tongue. The sublingual form helps bypass gut absorption issues common in older adults. 30-60 minutes before bed, take magnesium glycinate to promote muscle relaxation and sleep support. 30-60 minutes before bed, take P5P active B6 together with magnesium if your clinician agrees. In the evening, with dinner or shortly after, take vitamin K2 MK7 with a small fat source, especially if you're taking D3, but only after discussing with your clinician if you are on anticoagulant medications. At any point in the evening as tolerated, buffered or liposomal vitamin C to support collagen and as an antioxidant during repair. Bonus small habit. If appetite allows, a small protein snack in the evening, a few ounces of Greek yogurt, cottage cheese, or a scoop of protein powder made into a light snack, can provide amino acids for overnight synthesis. Label for viewers. These are practical examples focusing on forms: magnesium glycinate, methylcobalamin, B12 sublingual, cholecalciferol D3, natural D-alpha vitamin E, P5P, buffered liposomal vitamin C, MK7K2. Exact doses are examples clinicians may use in practice. Discuss personalized dosing with your healthcare provider. Common questions and clinician-friendly talking points. When you bring this plan to your clinician, here are concise points to discuss. Ask for vitamin D and B12 blood levels, and for guidance if kidney function or liver disease is present. If you take blood thinners, explicitly ask about K2 and how to manage any changes safely. Mention any change in nighttime symptoms, cramps, tingling, sleep quality, and functional measures rising from a chair, walking distance. If you take multiple pills at night and are concerned about pill burden, ask about combination formulations that preserve recommended forms, but avoid over-the-counter combinations that use inferior chemical forms, for example some magnesium forms or synthetic vitamin E formulas. Discuss whether adding a modest evening protein snack is appropriate for your digestion and medical conditions. Safety recap: the non-negotiables. If you take prescription medications or have chronic kidney disease, heart conditions, clotting disorders, or are undergoing active cancer treatment, talk to your clinician before starting or changing supplements. Do not stop or reduce prescription medications on your own. Changes require clinician oversight. When I share dosing examples in clinic, those are starting points for a personalized plan, not universal prescriptions. If you experience new symptoms after starting supplements, such as unusual bleeding, increased bruising, severe digestive upset, or neurological changes, stop and consult your clinician promptly. Where to look for evidence and how I use studies in practice. I base this approach on physiological principles, clinical experience, and peer-reviewed studies that investigate nutrient roles in muscle, nerve, and connective tissue repair. Rather than naming unverified sources in the video, I've compiled a list of vetted studies and reviews linked in the description so you can read the data yourself. When you review papers, prioritize randomized controlled trials and systematic reviews, and consult your clinician to interpret findings in the context of your individual health. One last practical nudge. Start with one change tonight. If this all feels like a lot, start with one simple low-risk step tonight. Take magnesium glycinate about 30-60 minutes before bed and see whether sleep and nighttime cramping improve over 2 weeks. Or, if nerve symptoms are more prominent, discuss a methylcobalamin sublingual B12 with your clinician and consider getting a B12 blood level. Small, consistent changes are what create durable gains. Closing. Independence is a night-by-night process. Recovery and strength are cumulative. The big advantage of this nightly ritual is that it targets the body's primary repair window, the hours of sleep when muscle, nerve, and connective tissue are being rebuilt. By aligning timing and using the right nutrient forms, you give your body the tools it needs when it needs them most. If you're ready to protect your leg strength, pick one change from tonight's checklist. Talk with your clinician about testing and medication interactions, and track how you feel over the next few weeks. The goal is steady, measurable improvement. More comfortable mornings, easier standing from a chair, safer walking, and greater confidence in daily life. If this message matters to you, please subscribe for more calm, science-based guidance for aging well. And if you're willing, tell us below where you're watching from and what you currently take before bed. It helps others learn what's working in real life. Finally, a clear safety reminder. If you take prescription medications or have major medical conditions, talk to your provider before starting new supplements so you stay safe while supporting repair.